Hello and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Anna Popper. Today's episode is part of an ongoing series on addressing key challenges in the management of viral hepatitis. This series features conversations between a patient and a clinician where they discuss developments designed to improve access to treatment and care of patients with hepatitis, often describing their own experiences. In this episode, Dr. Stacey Trooskin of Philadelphia Fight Community Health Centers has a conversation with Brother Dan Palmer, a musician from Nevada and a member of the National Patients Advisory Committee for the American Liver Foundation. Dan's journey with hepatitis C began more than 20 years ago and took him from California to Florida in search of treatment. For more information about our guests and for a link to additional online education on this topic and more, please visit the link in the show notes. So Dan and Dr. Trooskin, thank you very much for joining me today. I'm going to turn it over to Dan to describe his diagnosis with hepatitis C.
My name's Dan. I am a lifelong professional musician. I was diagnosed with hepatitis C in 1999. At that point, hepatitis C was fairly new. And here in my home state of Nevada, there is no liver center anywhere in the state. So finding someone who was up on all the latest information, et cetera, was impossible. And at that point, the only thing that was possible for such a diagnosis was interferon, and ribavirin was the treatment. So I didn't go through treatment. There wasn't much information here. People were not helpful to me. My doctors said, "Oh, don't worry about it." And I went on for a while managing myself, trying to eat right and exercise and learning what I could from the internet and that kind of thing. But eventually in 2009, I began to swell up with fluids. I was on tour and I gained 50 pounds in a matter of weeks. And I began itching and I just all kinds of weird things. So something was seriously wrong. And I went to the doctor. Because I was a musician and self-employed and had no insurance, I went the homeopathic route, went to try holistic medicine and did a lot of unproven things, oxygenation, just treatments and infusions, and nothing helped, obviously. And eventually, in 2009, I passed out in the backyard. The ambulance was called. I made it to the hospital, and then while at the hospital, those varicose veins in my esophagus burst, and I started bleeding internally. They did go in and they bandaged some of those, 7 or 8 of them, and then I had 10 days in a coma. 3 weeks later, I was released, and it wasn't until I was being released, being rolled out of the wheelchair with an oxygen bottle in my arms, being released because it was the last day of the month, and because I didn't have any insurance, they released me before the new month started. And on the way out, my caregiver is looking at the paperwork and asks the nurse who's pushing my wheelchair, "Hey, ESLD, what's that?" And the nurse actually said, "Well, that is Dan's diagnosis. That's what he has." And Melissa said, "Well, what is it?" And the nurse said, "End-stage liver disease." And that was the first time I'd heard that term. By the time they released me, they said, "You got about 4 months. You can go, put your affairs in order. If there's something you've always wanted to do, go and do it. There's nothing we can do for you, nothing you can do for yourself. Good luck. See ya." Well, that was pretty frightening. We went home. One of the doctors had mentioned on the side to my caregiver to check UCSF, University of California in San Francisco. And so she called over there the next day. They did not accept Nevada Medicaid, which I had not quite qualified for Nevada Medicaid. Because I'm a musician and I'm in the state I live in the state capital, I know all of the politicians. I've played music for their fundraisers and the judges and the senators. And so my friends embarked on a letter writing campaign, and they were able to get me onto Social Security disability, which was huge. That, you don't get Medicare until you've been on that list for 2 years, but it immediately qualified me for state aid, including supplemental income, which at that point was like $400. And in my home state, I applied for unemployment and welfare, and they actually told me that I was making too much money that I didn't qualify. And how do you survive on $400 a month? So we ended up in California. They called with a cancellation about a week after I got out of the hospital. My caregiver had been calling every day. And they called and they had in the evening, they called and they had a cancellation the next morning, which meant we borrowed my brother's SUV, put a mattress in the back, me with a little portable urinal and an oxygen tank, napping in the back as my wife drove overnight to the hospital in San Francisco. We got there. I thought I was just going to have a meeting and, a little evaluation. And before we were done, the doctor looked at me and said, let's start some tests right now. We're going to put you in the hospital. We're going to get a bed ready for you. I spent 3 weeks there before I was released. They very aggressively went after the varices and banded another 10 or 12 varices. They put a TIPS, a transjugular interhepatic portosystemic shunt, which released that pressure. Now, the thing is, that allows all the fluids to start flowing, but my liver still wasn't working, so the toxins continue to build up. However, it releases the pressure. So they told me that it would probably result in some mild confusion, which is how they describe hepatic encephalopathy. That's what it's called. And encephalopathy is one of the most serious things that it's insidious. I passed into comas, standing up, froze in the middle of 5 days after they released me from the hospital in that stay because of a buildup of ammonia. And so there were a number of factors that were playing in that, and I was able to dial those things in. Nutritional factors, certain vitamins and minerals that helped control that. I even went through hepatitis C treatment the first time. I went through interferon, 48 weeks of interferon. And then that starts to kill everything inside. So my red blood cells dipped dangerously low. So then I added a weekly self-injection of Procrit to build my red blood cells. And a couple weeks later, my white blood cells are dangerously low. So they add a weekly self-injection of Neupogen to build my white blood cells. So now I'm doing 3 weekly injections, plus I'm taking ribavirin every day for 48 weeks. At the end of that, we tested, and testing still wasn't what it is now. Treatments were not what it is now, what they've progressed to. They actually told me I was undetectable, which meant they could only count down to 15 parts per million of the hepatitis C virus in your blood. And so you could have less than 15 and they couldn't tell. They didn't know if it was gone or if it was still there. Sure enough, it ended up coming back. But at that point, when I was undetected, they actually told me that my best hope to get a transplant in California at that time was to get liver cancer. And I said, you call that hope? It was crushing, because that makes you sicker and it means you're closer to death, which brings you closer to the top of the list. The truth is only 1 out of 3 people who are waiting for a transplant ever receive one. The rest of them don't make it. But I managed to dial it in. Because the list is so large in California and in New York, those people are really highly skilled at managing very sick patients to get them to the point where they can handle a transplant, because you have to be healthy enough and strong enough to take the transplant once you get there. And you're getting sicker and sicker as you're waiting. 3 weeks later, I landed in Florida with one friend. My wife had one friend. And I spent 4 years there. Took 3 years until they started calling me. They called me 4 times. 3 times I was the alternate. The last time I was qualified for the transplant. I knew this one was for me, as long as I was okay when I got there and the organ was viable. The transplant was a great success. 5-hour surgery. I was home in 5 days. I was walking 12 hours after the surgery around the nurses' station. For me, it's been a miracle, a real success story. It's not that way for everyone. But 6 months later, I was back at level 2 fibrosis already. Level 4 is end stage. So I was halfway there 6 months later because of the hepatitis C with my newly transplanted liver. Well, they said at that point, we're going to treat you again. And the reason they were hesitant to treat me is because I have a strange genotype 3. And then now I'm post-transplant, so it's a whole new data set and that we're waiting to see what the evidence shows is going to happen. And so they again kept very close tabs on me. The third time through treatment, it was sofosbuvir with the cladisvir and ribavirin, and 6 months of that. And the ironic thing of that, they said, oh, it's all down to 12 weeks. You're only going to have to do it for 12 weeks. I said, okay, great. I did 12 weeks, and I kid you not, it was the last. I had been at the doctor's office 2 days before. They said, you're almost done. Awesome. I took the last dose, and it was not 5 minutes later that my phone rang. And the doctor called and said, hey, we told you we weren't going to have to take any more, but we want you to come in. We need to give you another 3 months supply. Because the data had just come in that for genotype 3, 12 weeks was not enough. You needed to go, it turned out about 16 at that point. And now some of these treatments with virtually no side effects are only 8 to 12 weeks long. So as one pill in some cases. So, the advancements have been incredible. And if they had made those advancements a few years earlier, I would not have had to go through a transplant. A lot of my story would never have happened.
Dan, I'm so struck by your story and your perseverance and your willingness and desire, your zest for life, first of all, but your willingness and desire to move to different places in pursuit of life and healing. And I think what resonates with me most about this story is the fact that your life depended on where you lived at the time and your ability to receive the care that you need. And that may have been for transplant, but the parallel here around access to hepatitis C treatment, which if you had been diagnosed now, not in the pre-DAA era,
right, we
would have been posed with a similar kind of conversation, but related to hepatitis C treatment and not so much transplant. And right. I think the restrictions that now exist, depending on where you live, vary, particularly with Medicaid. And, there are 3 different types of restrictions that could exist in some Medicaid programs. The first being the disease severity requirement. And in 2000 and right. In 2014, when the DAAs were new to market, there were many more restrictions around fibrosis score that in many states, you had to have advanced liver disease, you had to have cirrhosis or advanced fibrosis in order to qualify or receive hepatitis C treatment. And thankfully, those have gotten better across the country. And most people, although there are still states that have exceptions, you can have now no fibrosis, which is, of course, what the data and the guidance says, is that we should be treating as early as possible so nobody will ever have to experience what you experienced and develop advanced liver disease related to hepatitis C. The second type of restriction is the sobriety requirement. And this one is much more prevalent still among Medicaid and certain payers, where individuals need to demonstrate that they've abstained from drugs and alcohol for a certain period of time. And I find this one particularly troublesome because the data overwhelmingly shows that it doesn't matter whether you're using drugs or drinking alcohol, you can still cure if you take your DAAs. And in fact, it's better to remove the insult of the hepatitis C to the liver if you are still drinking alcohol, because then we're not pouring gasoline on fire. We're not rapidly progressing in the same way.
Yes.
And then the last restriction that varies based on state is that prescriber requirement, and whether or not we need to be a subspecialist like me in order to prescribe treatment. And in the face of the opioid epidemic, to live in, perhaps a state like Nevada, where there are lots of areas that are more rural and don't have a lot of subspecialists, you need your primary care provider to be able to prescribe this treatment without having to drive to Sacramento or drive to a large university-based system to get the care that you need. through a specialist. And so those three types of restrictions vary based on state still. And we still have work to do to make it so that it doesn't matter where you live, you be able to access DAAs no matter what. You have survived more than I think most people could ever imagine. And I'm so glad that you did, because the world for sure is a better and more interesting place with you in it.
Yeah, the outcome was so awesome.
Yeah. So let me ask you this, Dan. You know, the DAAs that we have available now, if somebody is tested early in their infection and they're treated early in their infection, the hope is that nobody will ever have to experience what you experience, that we can imagine a world that is free of hepatitis C. So what advice do you have for people who maybe don't know their status or are on the fence about being treated and are kind of letting their liver disease progress? What are your thoughts there, and what messages do you have for them?
Wake up, smell the burning coffee. It's a simple blood test. First, to see if you've been exposed to hep C, and then just find a way to get treatment. Now, treatments are down to 8 to 12 weeks, sometimes one pill a day. And that's it. Very minimal side effects. And it's only 8 to 12 weeks. It's not 6 months. It's not a year. It's not injections. It's not sickness and nausea and headaches and fatigue. It's not any of that. It's like, pop a pill and be cured. Hello.
It is quite gratifying, I would say. I mean, certainly gratifying as a patient to be cured and to have that weight lifted off of you. But as a provider, I have to say it's one of the more gratifying things to be able to provide a patient with. I mean, patients are the ones that cure themselves. You all do the hard work of putting the pill in your mouth every day and staying adherent and doing that. But it's really, really wonderful to be able to work with folks to have them achieve that goal of eliminating hep C and curing. And so I think that's why it feels particularly frustrating to still have some barriers to hepatitis C treatment that exist, because this treatment is extraordinary. And in my opinion, one of the greatest public health accomplishments of our generation, because we now have a cure for a virus. And everyone should be able to access that.
Thank you, Dan and Stacey, for sharing that conversation with us. I really appreciate your time today. To listen to more episodes in this series and to learn more about addressing key challenges in viral hepatitis management, see the links in the show notes.